Okay, thank you. So let me start rolling. Hugging Club of India is an initiative to remove stigma around mental illness. We started in 2017 because a very close friend, Vishal Tandon, died of suicide. He was 40, his career wasn't going anywhere, and his boyfriend had just left. He thought talking about his chronic depression, people will think he's immature or weak, and that's why he took this step. So we came forward and started the Hugging Club of India so people can openly talk about their mental illness. Coming to me, I'm very closely associated with mental illness because I come from a very different family. My mother had schizophrenia and my dad has bipolar. So I grew up seeing my mom talking to ghosts and spirits. She would call up my uncle and say, your dead wife is sitting in my kitchen. I'm giving food and shelter. Please take her. With my dad being bipolar, whenever he got salary, he went to gambling houses and casinos and didn't come home for 7, 8 days. And my mom will sit home and cry. And he would come after exhausting his salary. So I grew up not being very proud of my parents till somebody told me very profound that Umang, your mom did not choose schizophrenia. Schizophrenia chose your mom. With my dad being bipolar, मेरे पापा बुरे इंसान नहीं है, उन्हें बुरी बीमारी है. It is not a character flaw, it's mental illness. So equipped with this, we started the Hugging Club of India. It's a support group where each and everyone have some kind of mental health challenge. They openly talk. So we call ourselves as stigma shatterers or change makers. I myself have taken medicine for ADHD and I take therapy for codependency. And we openly talk about our challenges. Coming to the hero of today's event, we have Dr. Avinash. He's someone who is a well-wisher of Hugging Club to begin with. He's always there giving me leads, references. You won't know, but he's played a significant role in striking down 377, decriminalizing homosexuality. And we'll ask his role later on as we move on. He's a founder of a support group called the Sousa Foundation, where he's doing a fantastic work, awareness program, working with children, caregivers, promotion of mental health things in school, colleges, corporate world. You can just Google that and you will find. And he's also the Mumbai president of Bombay Psychiatric Society, which is a very, very high profile post. And as high profile is, he's very down to earth. But one thing you don't know, besides being a psychiatric degree, he's done an MBA in HR, and he's also got a master's in psychology and counseling, and MPhil in psychology and master's in psychotherapy. So we have someone who is multi-talented and very compassionate. And I remember, it's so kind. Out of the blue, once he called me and said, Umang, if you have any patient who need help and money is a challenge, please give my number. So we have someone who's doing wonderful for the community, for the LGBT community and the mental health community, and is very, very down to earth. And he doesn't, in today's world, everybody wants a photo opportunity, but he stays far away from it. Can you please unmute and welcome psychiatrist Dr. Avinash D'Souza. Welcome, Dr. Avinash.
Okay.
Coming to today's topic, Dr. Avinash, is how to accept and resolve conflict of this mind and body, challenge. So to begin with, Dr. Avinash, can you explain, even I'm not able to understand what exactly is this mind and body conflict?
Well, I always tell people the first thing is we have to differentiate between the brain and the mind. Now, when you look at the brain is an organ which is in your skull. It's the organ that makes you think, feel, behave in the manner in which you do. The mind is the more functional component of the brain. So the mind is, how the brain works, how you think. The functioning component is the mind. So it's like the hardware and the software. The hardware is the brain and the software is the mind. But the mind is not linked only to the brain. The mind is also linked to your body. So generally, if you're stressed, if you're anxious, if you're worried, if you're depressed, if you're sad, there are a large number of physical symptoms that may be manifested by your body. So we have symptoms. These could be isolated symptoms. They may not be disorders, but at the same time, we have certain medical conditions which are also labeled as psychosomatic. That is, the mind and body are, interrelated. So the whole problem is that these are two interrelated conditions. So you actually have physical problems. It's not that you don't have, but these physical problems are probably aggravated by psychological issues. So it's like, if I'm stressed, my thyroid levels go up. If I'm stressed, my sugars go up. If I'm stressed, my BP goes up. So you actually have physical problems, and that's the whole mind body issue. And very often the reason why we're doing this topic is because we have so many patients that keep going to physicians, keep going to different doctors, and the doctors keep medicating them. The doctors are not wrong in doing that, but still the problems are not resolved, because the seat of the problem is in the mind. The seat is not in the body, but the body continues to suffer. Yeah.
Thank you for that differentiate between software and hardware. But doctor, is it also vice versa, that if I have cancer and chronic, and it will affect my mind also, vice versa?
Well, yes, it is well known. So let's say if I develop acidity, or I develop arthritis, or I develop a thyroid problem, and this continues for a long time, I tend to feel, why am I developing this illness? How long do I have to take medication? The illness affects my quality of life, and that can all lead to what is referred to as psychological effects of the illness. So you may tend to feel low, you may tend to feel anxious, you may tend to feel worried, you may tend to feel bothered. So definitely, even chronic illnesses, like even certain illnesses, I think even the diagnosis of the illness worries us. So for example, if I tell you you have tuberculosis or you have cancer, even being diagnosed by the illness would cause your mind to get rattled.
Thank you for Dr. Avinash for that. Yeah, anybody has a question, please unmute and ask the question. आप हिंदी में भी पूछ सकते हो, मराठी में भी पूछ सकते हो. Yeah, please, anybody go ahead. If you have a question, please unmute and ask. Or I'll take it from a chat box.
Before anyone asks, I will just add one thing, that there are certain illnesses which are referred to as psychosomatic illnesses. What do we mean by psychosomatic? Somatic means body. These are physical illnesses, and psychosomatic because they are aggravated by psychological factors. Now, these illnesses include 7 or 8 conditions which are very important for you to know. One is acidity and peptic ulcer. The second condition is probably bronchial asthma. The third condition is arthritis. The fourth condition is thyroid problems. The fifth condition is skin problems like eczema and psoriasis and these kind of chronic skin problems. Then we also have cardiovascular problems, which are, and blood pressure, which are linked to psychosomatic disorders. And finally, but not the least, we also have gynec problems, which may be psychosomatic in nature. Yeah.
Okay.
Yeah.
Thank you. So,
Oman, can we have these effects listed in the chat box? Can somebody write down these psychosomatic, because it is a little too fast for us.
We are recording this. Shayan, you can take it. We are recording this. Okay, from the recording. Okay. So, doctor, there is a question which says that I'm gay and my parents are hell-bent to make me straight, and they think it is all in my mind. And how do I handle it? It's a nightmare staying at home, How do I handle them? They think it's all in my mind.
Well, sadly, I mean, I've always mentioned this as a psychiatrist and I always say I've recently, in the last 4 or 5 years, worked with members of the LGBTQ plus community. Prior to that, this was an area I didn't work in because I wasn't very aware of it. And when I started work, then I realized that many people come with this issue because parents probably don't realize and accept. And sadly, our parents belong to a generation which is quite heterosexist and homophobic and even patriarchal to some extent. So what happens is, the thought is that it was a disorder at the time they were growing up. So they keep considering it as a disorder when it's no longer a disorder. So very often what I suggest to these people is, please get your parents to a mental health professional who probably could explain to them that this is a way of living, it's normal, it's perfectly a normal sexual orientation, and that there's nothing wrong here. We would explain to the parents about the fact that these preferences are normal. We would also explain to the parent that there is no role of conversion therapy. In fact, the Indian Psychiatric Society is very clear that conversion therapy in any form is banned in cases of homosexuality. The only time where we may intervene is if a patient is uncomfortable with his homosexuality and wants to probably explore other sexual orientations. But this is if the patient himself comes to us and says, I'm uncomfortable and I think, I would like to sort of explore other orientations. It's not because the parent brings him and says change the orientation. So that is not at all a no. So if you have any doctor that assures you, we do conversion therapy and we do this and do that, it's absolutely wrong. It's absolutely not allowed medically. It's in fact medico-legally criminal to do it. So do not, make sure that they don't go into that. There are a lot of people who believe, sadly, hypnotherapy can change your sexual orientation, but it can't. There are a lot of people who believe counseling can change it, but it can't. It's something, you're born with, it's innate, it's something you develop over time, and it's something that we really, should not be looking to change. And I think I would love to talk to parents and explain to them that they understand this facet. Maybe if both parents don't understand, we go with a more accommodating parent first and talk to that parent and try and see how that could work.
Thank you. Thank you. This is really path-breaking coming from a very senior psychiatrist that this is not a mental disorder. And you said something very profound that when parents were studying or that time it was labeled as disorder and they continue with this thought, So thank you for that sharing. That is a gem. Thank you. Yeah, Dhanashri has raised your hand. Please go ahead, Dhanashri.
Hi, sir. Good evening. This is
Yes.
in regards to the continuity of LGBTQ community. In terms of reporting the coming out, it is a complete personal decision, right? If the client shares and the client relationship is not established because I am the facilitator and the child just shared that he or she feels whatsoever they do, as and far the academic performance, the extracurricular performance, or the mental stability of the child is not getting affected, the parent's involvement or the idea that I should share this information with the parent or the school does not exist. Am I right?
Well, see, there are two aspects here. Now, generally, I work in schools and we have a number of adolescents that come to us with
Yes.
feelings of, homosexuality, and they very often talk to us. What my approach as a psychiatrist normally to them is that when you're in the adolescent phase, you go through different phases of your sexual orientation. You may feel you're homosexual, you may feel you're bisexual, you may feel you're heterosexual. So I normally tell them that whatever you feel, we go with that, and we do not worry about it. We see how that goes. But most importantly, what is very, very important is we do not label anything at present. We wait till the person is 18 plus, has a fair amount of sexual exposure and experience before which he decides and comes to a conclusion with regard to his sexual orientation. It's also very, very important that we may have to inform parents at times only if the child wants us to, but it's also sometimes prudent because the child is underage, and if the child comes to us and says that these are the feelings, we definitely try and inform one parent at a school level so that the parent is a little cognizant about it. But many a times we have parents who are not at all open to this. So we generally tell children that, let's not reach a sort of conclusion to sexual orientation at 14 or 15. Let some time pass. Once you're 18 or 19 and you've had a fair amount of sexual exposure, or 20 or 21, and you're sure that, yes, this is the orientation I want to have, then we sort of go with that. And that's the time we sort of come out and talk to parents and otherwise.
So in this occasion, the child has not attained 18. However, she's a migrant from abroad,
right,
and is open to, saying and suggesting and is following the particular community that he or she belongs to. So here, as a professional, I decided not to take the parent into the account. given the fact that there is recent migration in 2020 and the family dynamics is a little conflicting and not great, unstable.
Right.
So that was the call. Other
No,
than that,
my only premise here is if the child is underage,
okay,
you can sometimes be, if she's below 18,
right,
you could be pulled up as a counselor for not having informed.
right,
So generally, see, when we have anybody who's below 18, for anything and everything, the parents have to be taken into consideration.
okay,
That's the rule. It's not, I mean, even if he's had a single smoke, even if he's had, one experimental exposure with weed, even if there has been some accidental, incidental sexual exposure, I mean, tomorrow
right,
the parents can pull you up for saying, why did you hide this from us when
right,
the child was underage? If the child is 18 plus, it's absolutely fine. You can
okay,
go with the confidentiality clause. Why I'm saying this is because the legality says that parents have to be informed. Apart from that, the school may be pulled up for hiding this. So I mean,
right,
you can always have a joint session with the child there and the parent there, and talk to them about this, so that you're not doing this behind the back of the child, but you may
right,
have to do this if needed. And I think if the parents are from a foreign national country, they would probably be a little more open and understanding to this premise also.
okay, okay.
Yeah.
Thank you.
Yeah.
Okay, does anybody have a question? Please unmute and ask. Go ahead. Or if you are hesitant to ask directly, you can put it in the chat box. Yeah, go ahead and unmute. You won't get a chance to ask him a question directly. He's a very busy and a renowned psychiatrist, in Bombay. And can you imagine, this is the third session in the day he's doing, and after 9:30, he's going to have a session in Africa, so he's very busy. Yeah, Ria, go ahead. Yeah, Ria, go ahead. Ria, you have raised your hand. Go ahead.
Good evening, Dr. Avinash. Can you hear me?
Yeah.
Okay. I have actually two questions. One is that, see, you were talking about like psychosomatic diseases, right? And like the mind affecting the body. So because of like severe stress and the kind of environment I've had at home, like I started experiencing hair loss like fairly early, like when I was in college since 2004. And that has affected my self-esteem. And now it's like really, really bad. And the other thing is that throughout my career, I've had like job instability, right? So this really impacts my self-esteem in the sense, like when I interact with my peers, I always feel like they're better than me. And, like they're doing so well, and why I'm not able to, because I'm like completely low on motivation. And I've been diagnosed with like anxiety, depression, and a bit of OCD. So how do I like overcome? Because currently I'm 37, and being financially independent is like really important. So if you could just, and that is one aspect. And the hair loss affects my personal life in the sense like, because I've been wanting to get married. So, it sort of affects me mentally.
Right. Well, I think, Ria, what's very important is that, you have what we refer to as a psychosomatic skin disorder, wherein you have this hair loss, which is, of course, physical, but it's affected by psychological factors and aggravated by it. Now, generally, this would need what we refer to as a consultation liaison approach, where two specialists work together. So you would need the skin or the hair specialist to work together with your counselor or your psychologist or psychiatrist, whoever is dealing with it. If you feel that anxiety or depression is a very significant factor that affects, you would need help for that side by side, apart from skin treatments for the hair, etc. If the alopecia is a genetic condition, wherein, this is something that is in your family and it runs, then of course treating it would be a little difficult with psychological treatment alone. But I think what's very important is that you have the combination of medical and psychological treatments that play a role. And I think your skin and your psychologist should probably liaison well together. And you'll also have to look at triggers that lead to hair loss, triggers that aggravate your condition, and that will have to be worked with in therapy. And if needed, little medication to reduce your anxiety or stress may be prescribed, that even your skin specialist could do it. It's not necessary that you have to visit a psychiatrist.
All right. So I have gone in for therapy, and I have consulted a dermatologist as well. So that has been done in the past. With regard to job instability, because I'm completely like low on. I've not been working for the last 2 years now. So like I don't know, like I don't even feel like doing up my resume, like sort of editing it and like putting it out because of bad experiences that I've had, like toxic environments that I've worked in. So yeah, so like how should I like deal with it?
Right. So I think what's very, very important for you to understand here is that, see, now job instability is something which probably many of the people have been through in the pandemic. And apart from that, job instability is something which may be a little difficult because it's something which is beyond the realm of the psychologist. It is more about getting the right job, the right salary, so many other factors. So probably, I mean, you may need to look at first getting a job that gives you some stability, which would be one factor, but that may not be the only factor always. There would always be other factors in and around that probably contribute.
All right, thank you so much.
Yeah,
thank
you, Dr. Avinash. So we have somebody who's gathered the courage to talk in Hindi, and she's from Orissa. Divya, please जाइए, आप हिंदी में पूछ सकते हैं अपना प्रश्न.
हेलो सर.
हाँ, हेलो दिव्या, बोलिए.
हाँ सर, तो क्या ये होमोसेक्सुअल हेट्रोसेक्सुअल में बदल सकता है? जैसे घर वाले का मानना ये होता है कि तुम्हारा ये थॉट है और ये परमानेंट नहीं है, अगर तुम लड़कों के साथ ट्राई करोगी तो हो सकता है कि बदल जाएगा. तो क्या हमें ट्राई करना चाहिए लोगों, मतलब पेरेंट्स के कहने पे?
ठीक है. अभी इसमें देखिए, दो चीजें समझना बहुत जरूरी है कि होमोसेक्सुअल से हेट्रोसेक्सुअल होना ये घर वालों की अनुमति पे निर्भर नहीं है. ये जो है आपके जो बच्चा है या जो इंसान है जो होमोसेक्सुअल है, उसका मन क्या कहता है उस पे निर्भर है. अगर उसका मन कहता है कि होमोसेक्सुअलिटी ही उसकी राह है तो वो उस राह पे चलेगा, क्योंकि होमोसेक्सुअलिटी एक बीमारी नहीं है, ये एक सेक्सुअल ओरिएंटेशन है जो बिल्कुल नॉर्मल है. कई बार हमने देखा है कि लोग अक्सर ये गलत फहमी में रहते हैं कि ये एक बीमारी है, इसको बदला जा सकता है, थेरेपी द्वारा इसको चेंज किया जा सकता है. अभी मैं एक हेट्रोसेक्सुअल होने के नाते एक बात आपको कहूंगा कि अगर समझो मैं हेट्रोसेक्सुअल हूँ, मेरी पत्नी है, मैं उसके साथ सेक्सुअल संबंध रखता हूँ, और आप सडनली मुझे कोई और औरत लाके दोगे और बोलेगी आप इसके साथ ट्राई करो, तो वो नहीं होगा, क्योंकि मेरी भावनाएं वहां जुड़ी नहीं है, मेरी फीलिंग्स वहां जुड़ी नहीं है. वैसे ही अगर आप एक होमोसेक्सुअल इंसान को सडनली किसी औरत के साथ रखोगे और कहोगे कि आप इसके साथ ट्राई करो, तो आप अपने आप हेट्रोसेक्सुअल हो जाएंगे. वो नहीं होगा, क्योंकि उनकी भावनाएं और सेक्सुअल फीलिंग्स वहां जुड़ी नहीं है. उनकी सेक्सुअल फीलिंग्स सेम जेंडर, सेम सेक्स के साथ जुड़ी है. तो और उसमें भी वो बहुत क्लियर है कि उनके पार्टनर्स फेथफुल होते हैं. ये ऐसा नहीं है कि मल्टीपल पार्टनर्स के साथ होता है. उनका भी रिलेशनशिप उतना ही मजबूत है जितना एक पति पत्नी का रिलेशनशिप मजबूत होता है. तो ये बीमारी नहीं है जिसको हम बदल सकते हैं. मैं उल्टा ये कहूंगा कि घर वालों को काउंसलर के पास जाके समझना चाहिए कि होमोसेक्सुअलिटी क्या है, ताकि आप अपना मन साफ करें, अपना मन क्लियर करें, और फिर आप अपने घर में इस बच्चे की और भी अच्छी तरीके से मदद कर सकते हैं.
थैंक यू सर.
Thank you, doctor, for explaining that in Hindi so nicely. Thank you. Does anybody have a question? Please go ahead. किसी को पूछना है? इनकी अपॉइंटमेंट लेंगे तो बहुत बार वेटिंग कर रखना पड़ेगा. यहाँ कोई वेटिंग नहीं है. Go ahead and ask a question. यहाँ कालिंदी, go ahead. Kalindi, go ahead. Kalindi, unmute.
Hello, sir.
Yes.
Yeah, I'm audible, na?
Yeah.
Audible,
Yeah.
audible.
Yeah. Thank you, sir. I wanted to ask you that my husband and my both children, they were into alcohol and physical abuse. I have gone through 30 years, and then he met with an accident. So now I'm taking care of all three. All three had an accident. All three I have nursed them, and then, but now again they have started drinking alcohol, and they all three are physically abusing me. So I went for a complaint because since I joined this club, I opened up because earlier I was not, and then everything is going on. But now what happened is I am getting affected. मेरे ऊपर काम हो रहा है. उमंग जी ने मुझे साइकियाट्रिस्ट से आई एम ऑन मेडिकेशन एवरीथिंग, बट they three are into alcohol. Even they need to be counseled and all. So, but right now they are not going for it. I have to try for that, but I'm going through a lot physically also. Even my son, after 2 days physical abuse, today also physical abuse, today in the morning. कभी हो सकता है, कभी who will come to hit on तो that husband आएगा, बड़ा बेटा आएगा, and my bigger elder son is 30-year-old and smaller son is 26-year-old, husband is 62.
Okay. Kalindi, I must just mention that it's a little sad that you're in the state that you're in. And if, you're undergoing this kind of abuse, I think no one, including you, deserves to undergo
Yes.
this kind of abuse. So it's very important and prudent that apart from just a complaint, you will have to see that they seek help, because of course they're part of your family.
Yes.
So you have 2 or 3 options. One option is that you could of course walk out and lead your own life, but then I think that's not an option everyone would want to take. The second option is you would want to look after them as they're your kids and you have a husband there.
Same.
So one thing is that they probably would all need rehabilitation in some
Yes.
way. They would all need medical treatment in some way. So you could try and see that could be done with their will, without their will, based on whatever
Whatever the
state
situation.
whatever their state is in. And if I could help you in any way there, I'll be more than happy to help you. So you
Thank
could
you.
speak to Umang and take my number and contact me.
Yeah, thank you so much, sir.
Yeah.
And I'm thinking of that also, like, because I want to help them, because they all are 3 sick. So I want to help them themselves as a mother, as a wife.
Thank you. Thank you,
Thank you,
Dr.
sir.
Avinash. And
I have typed my number and email in the chat box for those who may want to contact me. And on this platform, I just want to tell people that you can always contact me for an opinion whenever you want. Even on a WhatsApp, I'll be able to sort of guide you as to what to do. So do
Thank
not
you.
worry at all. Yeah.
Thank you, sir. Thank you so much. God bless.
thank you. Thank you. That's so sweet of you to make yourself so easily accessible,
Yeah.
knowing your schedule and you want to go out and help. Thank you so much, Dr. Avinash. I really mean it for giving your number, and I thank you. So there is a question which has come that due to childhood trauma, I'm not attracted to male or female. I've become asexual. What do I do?
Well, I think asexual is also an orientation that people follow. It's a personal choice. If there has been childhood trauma and you feel that, I want to now explore a sexual life, then probably you need to undergo therapy for the same. Reasons for the asexuality will have to be prodded into, and then we would probably need to, probably take this ahead from a therapy mode or whatever other treatments are needed, or a trauma-based therapy, multiple other things which can be tried. But if you choose to remain asexual because of a personal choice, that's your personal choice. We wouldn't worry about that.
Thank you. Thank you. There is a question in chat box, but if anybody wants to ask a live question, please go ahead. Please unmute and ask the question. आप पूछ सकते हो हिंदी में, इंग्लिश में, मराठी में. Please go ahead. Okay. If you're hesitant, you can add in the chat box. There's a question which says that does schizophrenia affect sexual health or sexual intimacy?
Well, schizophrenia as a disorder does not affect sexual intimacy per se. But yes, a patient with schizophrenia may have less emotions, less feelings, may not want to be involved sexually. Some of the medications which he's on can sometimes affect sexual functioning. So there would be multiple factors that play a role. But more than that, the lack of relationship and the lack of interest in a relationship could lead to it affecting sexuality.
Thank you. Thank you. Dr. Avinash, I want you to just run down how you helped, what was your role in bringing down 377 and decriminalizing homosexuality?
Well, this happened a few years ago where the Indian Psychiatric Society wanted to probably have a task force which would look at mental health issues related to the LGBTQ plus community. I have always been part of school psychiatry and child and adolescent psychiatry, and we did a lot of good work there. So they, threw this into our laps and said, this is a new baby, and you all have to manage it. We were very worried because we had never worked in this area before, and we said there is so much of emphasis on being accurate and using the right terminology, and we didn't want to offend anyone on the way. So we had to actually go and read up and learn and probably try and understand what we're dealing with, because we had few psychiatrists who worked in this area. We took their opinion. We took the opinion of various NGOs that worked in this area, and we started doing workshops on this whole awareness for LGBTQ plus communities. We were met with some opposition initially. We even had a few members of the LGBTQ plus community who accused us of not doing anything all over the years. And we said, we agree, nothing was probably done. It was wrongly named a disorder. All those things happened, but now we've come to try and do something. So, please cooperate with us. Then the matter was in court. And when the matter was in court, the lawyers told us that, would you all be able to give a statement that it's not a disorder, and more so a recorded statement. Apart from that, would you be able to give a written statement? Would the Indian Psychiatric Society endorse that it's not a disorder? Because that would be a very big thing for the court. So we were very lucky that in our tenure, this happened, and we could pull all the strings possible, get the Indian Psychiatric Society to endorse this. And I think it was even in the judgment, our statements have been quoted, and I think that was, quite path-breaking for us, and something that we'll probably remember for a long time. Yeah.
Thank you. Can we please unmute and give him a round of applause? He's one of the persons responsible for bringing down 377 and decriminalizing homosexuality. It's an honor to have you, and thank you so much for doing, and especially being a heterosexual, you've helped so many homosexuals. Thank you so much. Okay. There is a question which I'll read out from the chat box. I have severe anxiety and OCD regarding certain entrance exam. Now that the chapter is closed and I have moved ahead, I'm on medication for the same and have tapered them off by reducing those in proper manner. Strictly under the monitoring of mental health professional itself. Now the episode has passed, but still somewhere in everyday's life, I feel my response to certain situations is not normal and tend towards anxiety, so not that intensified like previous episodes. I feel anxious on low-grade scale, and I've acquired this anxiety as there is a strong history of same in my family. Because of this hereditary thing, I feel very cursed at some point. Why I have to suffer because of my anxiety, which I got as a free gift. Also, I feel sad that with the thought to be of such a low grade spectrum of uninvited anxiety at any point throughout the life. And will I keep suffering like this throughout my life? So, yeah. It's not my fault. Yeah, sorry.
Yeah. Well, I think what's very, very important to understand this is that I think we would have to probably, I don't know anything about your case and how it started and how, it went on and on what medication you were and how you've elaborated whatever you can. But I think if you feel that there are still some ups and downs and anxieties remain, then I think, we would want to look at a therapy approach where probably certain loose ends of the anxiety could be tied up with maybe some SOS medication for you when you need it, only when you need it, probably to help you tide over any panic that comes in your way. But I think beyond that, it could be manageable through a counseling approach. So that's something that we could definitely look at. Yeah.
Okay, thank you. I want to ask you, and to be honest, I want you to give me an honest answer, not a sugar coated. Since you work with so many homosexuals, and you work for bringing down 3000. So what I've seen in the gay community is rampant sex, orgies and drug, it's so common. And there is a whole school of thought coming that this whole monogamy is forced on. As a human being, you are born to be polygamous, and now there is a whole throuple and polyamorous and all these happening. So it's a dilemma. Okay, if I stick to my if I stick to my monogamous stand, I'll be left alone. There is a fear in the community. I am old school if I'm not changing. And then I'll regret in my life. So what is your take on it? It's a very important question.
Now, well, I would say, see, there are two perspectives. The first perspective is when you generally have a very stable relationship and a stable partner and things are going fine, then I think monogamy does absolutely fine for you. But, if you're the type who wants to have varied experiences and you want to explore in different facets, and you also feel that I am the type who's polygamous. I always believe monogamy and polygamy is something that comes from within. So it's what you want to do which also matters. So if that is there, then I think you automatically become open to the idea. I mean, it's very difficult to convert people who are inherently monogamous to become polygamous, and vice versa. It doesn't work that way. So I've had people who've come and told me the same thing that you mentioned today, and I always tell them, if you're comfortable with being monogamous, why are you worried? Why do you? And if you're comfortable with being polygamous, why are you worried? It's as simple as that. So yes, you may at times feel you're not keeping up with the times, but I think it's your personal comfort that matters the most. And if you're in a stable relationship and monogamy works well for you, there's no need for you to probably explore the entire horizon.
Thank you. Thanks for giving that clear cut, and it is so liberating, and comforting, that we can be ourselves, not get, by peer pressure, don't change ourselves. That is so good, because people feel we are old school or, whatever. Thank you. Yeah, does anybody have a question? Please go ahead. किसी को कुछ पूछना है? We have only 20 minutes left. Please go ahead quickly.
Hello, sir.
Yes.
I just wanted to know how much of a role does medicine and medication play in somatic disorders and in somatoform disorders, and releasing themselves in terms of the gustatory symptoms, or like you said, the skin symptoms or the acid or the ulcers, because as we see in the practicing, this is increasing every single day due to excessive stress. Acidity is one of the most common symptoms that people are experiencing, due to which they are taking many medications like antacids, etc., etc., etc. So what role would antidepressants play here? And are there any other source of medications in psychiatry which are used for somatoform disorders?
The treatment of psychosomatic disorders is three-pronged. When I mean three-pronged, one is we have to treat the somatic illness, that's the physical disorder. We have to treat whatever is physically affected. We have to treat what is psychologically affected. And we have to also change lifestyle. So all these three things go hand in hand. The problem is we go for a quick fix medical approach, wherein we are happy to take an antacid, a painkiller, do whatever it takes to get rid of the pain and the suffering, but we do not want to modify lifestyle. So a simple intervention like having your dinner at 8 p.m. every day can reduce acidity by 50%, but no one wants to practice that. We want to have dinner at 11 and go to sleep at 11:30. So that's something like that. A simple mechanism like reducing a little bit of spiciness in our food can reduce acidity. For some time, you can always have spicy food off and on, but a little bit of spice being reduced in our food, having a little bit of curd every day can reduce acidity. So there's small lifestyle modifications that can be done. And probiotic use to some extent can be beneficial. Your bowels can come through with a little bit of exercise. It can help. There's so many lifestyle modifications. Reducing your cigarette and alcohol consumption can reduce acidity. But people still prefer to take an antacid, and they keep popping antacids just like peppermint. And I always say that, it's something that you shouldn't be doing unless you really have an acidity problem. Apart from that, yes, if the underlying cause is depression, social isolation, anxiety, we treat that. We go in for therapy also, treat the person therapeutically. And if there are medical issues, yes, we treat the medical issue as well.
All right.
Thank you. Thank you, Dr. Avinash. And what you said, that I want to ask this question because a lot of people are struggling with sleeping and a lot of other, since this is psychosomatic. If you can give a list of mental hygiene to follow, so we don't fall sick, or, we are in a better state of mind,
Okay, now the thing is, one of the biggest problems in our lifestyle is we sleep with our smartphone, which is something that we shouldn't do. So I always tell people, when you go to bed, don't take your phone to bed with you, because it becomes 12 midnight becomes 2 a.m. before you realize. So don't do that. It's very important that you keep your phone away, keep your gadget away. The bed has to be used only for sleeping. I mean, you don't use it to eat, sit, do all other work. So it's very important. The light has to be dim. You may have music. You need to have a good aroma. Put some room freshener. I mean, sleep at the same time every day. It may take a week or 10 days for you to get your cycle in order, but be persistent and it will happen. Maybe some warm milk, maybe a little hot chocolate, whatever you like to have before sleeping, which will give you a good sleep, would help. So that's there. Also, do not think about the next day when you're going to sleep. Just focus on the fact that you want to sleep, which is very important. Never get into heated arguments prior to sleep. Never get into heated discussions or topics that will tick you off before sleeping. Don't message friends where you'll probably get into an argument before sleeping. So these are things which are very essential. Avoid caffeine after 7 p.m. It's something which is a very important, or rather 5 p.m., which is a very important role. So I think once you get all those things in order, your sleep hygiene automatically comes into place. Use the right pillow, very important thing.
Thank you. Thank you, Dr. Avinash, for giving that list of to do and not to do. Sriram has a question. Go ahead, Sriram.
Hello, Dr. Avinash. I have a question related to energy healing. It's different than what because you are more on the science side. So I developed kidney failure, and someone, I had to go through dialysis, and now I have a transplant kidney. But I met someone who is into energy healing, and she said that kidney related issues is usually when someone lives in fear all the time, like when it is associated with fear. So when I looked back, I kind of related to it because growing up, I had a narcissistic dad. I was always in this fear that if I like walking on eggshells, if I do this, he might get angry. Like all of us at our home was always like, dad will get angry, dad will get angry. And then as I grew up, I discovered that I was gay, and I was bullied and all that. So I was always in shame and always in fear. Like some people, they retaliate, they show anger. When I was the opposite, I would sulk and self blame, and always in fear. If I say something, someone might beat me up, all these things. So when I look back, I was like, okay, maybe that's why, because in our family we don't have any history of kidney issues. So is there any link between the two, or are they like, is there any overlap between these studies?
Yeah. Well, Sriram, see, I'll put it like this. I don't want to be, negative, but I'll be very clear that being a psychiatrist, I mean, I don't have any knowledge about energy healing. So I would always say I cannot comment for or against either, you know, because I wouldn't know. It's like I don't do hypnotherapy, so I can't comment about hypnotherapy. So I would
Okay.
just keep it at that I'm not aware. I mean, maybe it works, maybe it doesn't. I don't know. I wouldn't be the right person to comment.
Okay. Got
Yeah,
it.
yeah.
Thank you.
Okay, Doctor. Doctor Avinash, there is a question which comes to a topic that this conflict between, you know, the mind and the body, you know, why is it a conflict? You know, why can't they be two different things? You know, I can fall ill and my mind can only fall mentally ill and physically. Why is this conflict happening?
I think the conflict primarily happens because your mind is you. You know, your mind is not something which is visible. The whole of you is your mind. The whole of you is your body, and the both are in unison. In fact, they are inseparable. Just like your body and your soul are inseparable, they say. Similarly, philosophically, similarly, your mind and your body are inseparable. So therefore, the effect does happen.
Thank you. Yeah, Kapil has a question. Go.
Good evening, Doctor. Thank you so much for wonderfully explaining all the answers to the questions.
Kapil, you can
And
unmute and.
I have unmuted. Can
Yes,
you hear
yes,
me more?
yes, yes.
Thank you. It's great to know that you were a very significant part of, the Article 377 movement, basically. It's a very generic question that I'm asking because I really don't know what to ask, but I really want to ask you something. So here we go. How much? I'm sure you're going to you're going to have a major hand in bringing about change in terms of gay marriage rights, in bringing in terms of the cultural polarization that has happened in the country, especially with the current scenario in terms of the one leading party, you know, throwing off people and winning all the elections all across, and these culture and this particular party is also very extreme in their cultural approach towards politics and people, and they could definitely have a big hand if I tomorrow want to go and make a change in the law. So what would you have to say, and how? I don't want to become an activist, but I really would want to support somebody and talk to people and have a conversation around my community in Hyderabad over here, and see what needs to be said. So what can be said to these people?
Well, I think what's very important to understand is that when Section 377 was repealed, it was a Supreme Court ruling, you know, that came, and I think you always have the ability to go to court. You always have the ability to go, seek justice when you need to. So I think that's the route, you know, you could always take. Whatever is scientific, we will always support. Whatever is scientific, we will always back. And I think that is not a stand that's going to probably change. And I cannot comment on, you know, the political aspect about this whole thing, but I can definitely comment that if, you know, I'm called by a court of law, I would probably, you know, give a statement which is purely scientific and definitely not based on what uh, the political fervor would want.
I just hope policy and politics supports the change. Thank you so much for answering the question, Doctor.
Thank you. Yeah, does anybody have a question? Please raise your hand or you can unmute and ask. Please go ahead. We have just hardly 10 minutes. So Doctor, this is a question from myself that, you know, a lot of gay guys, you know, want to look young, you know, it is very perilous, a lot of. So, as you said, you know, all these thinking well about your mind and all, you are not going to be fitter and healthier. So, what should that go in? That, you know, what should that go inside our head? Because it's such a contrast, you know, we are fighting, getting bullied and all. And with all this will make us look not very good and have problems. And other side, we want to look very young also. And we are facing this trauma, you know. So what do you say? You know, how do we take care of our mind? You know.
Well, I think you need to be with people that give you positivity. You need to be with people that keep you happy. You need to do things that make you happy. You need to sleep well, eat well, have the right friends. You know, this is something that, you know, I've learned, and I always believe that you know, you can always help people to come up if they want to come up and they want to improve and they want to, get positive, they will come up, no matter what you do. If they don't want to do it themselves, you can't do it for them. But the same is not true for negativity. Negativity will always pull a good person down. It doesn't matter how good you are. So it's important that you stay away from negative people, I think, which is very, very important. And I mean, in Hindi, I would say this, that this is something I saw on an Instagram post today, and I will say it, that न दोस्ती के लिए न मोहब्बत के लिए वक्त रुकता नहीं किसी के लिए, अपने आप को न दुखी कर इस दुनिया की बेरुखी के लिए, वक्त के साथ साथ चलता रहे, यही बेहतर है आदमी के लिए.
Thank you. Yeah. Does anybody have a question? We have last 5 minutes.
Yes. I have one question. You just spoke about negativity. So my mom is like very narcissistic and she's pessimistic. And the thing that affects me the most is that I'm not able to, like, see, whenever I have to go out and meet a friend, she's always accompanying me. Or if I'm out on a date, she's dropping in and checking out the guy, how he is and is he safe, or will he like trouble my daughter, sort of a thing, because she's a mom and she has some worries. So how do I deal with that? That is one thing. And because of the pandemic, she's saying, if you're looking for a job, work from home, no need to step outside and work. So that is the other things.
Well, I think I would say that, your mom may need therapy in some way to, help overcome her anxieties, which is very important. And also, I think, maybe you'll probably have to tell her a few things, not tell her a few things. I'm not telling you to lie to her, but I mean, you'll have to probably find, your own peace, so that you don't have a helicopter parent around you.
All right. Thank you so much. Thank you.
Does anybody have a question? Please go ahead. किसी को कुछ पूछना है? You can unmute and ask. Yeah. Okay. So,
Sir, one sec.
Yeah.
Sir, sorry, again I'm asking. Sir, what happens is, you said that you need to have a good sleep. Your cycle should not be changed. But in my case, what is happening? All three consume alcohol, and then I have to stay awake because my elder son, he sometimes gets up in the middle at 1 a.m., 2 a.m. He'll reach home, and he's so drunk, and then he gets up and pees. So till he pees, anywhere, not in the bathroom, he doesn't go to the bathroom because itna alcohol consume kiya hai. So if he is a 30-year-old, so you can imagine what I'm trying to tell. So instead of me cleaning everything, I don't have a servant. In 30 years, I've never kept a servant. All my domestic work, I do myself, my daily course. So, I stay awake. I make it a point, if he wakes up, he goes to the bathroom, I make them go to the bathroom, pee, and then come out. So this till twice they pee, then I have to stay awake till 1 a.m., 2 a.m., 3 a.m., nothing. So I can't keep my sleep cycle. It depends on the house people. And then this medication also I'm taking.
Well, Kalindi, I think in your case, it's not about your mental health won't improve unless some of them get treated.
Yes.
So I think, so, you'll have to work on getting them treated.
Yeah.
And then while they are away, we work on you.
Yeah.
Yeah.
Because it is helping me at least to keep my mind, and Umangji is helping me in that.
Yeah.
Thank you for both. Thank you.
Okay, so this is the last question of the day. Dr. Avinash, you made us explain that mind and brain are different and it will affect our health. But in the midst of heated argument, we forget all this, We just want to shout, yell, and then in the long run, all these, illnesses will manifest. At the time when we are in the heated thing and how to take care of our anger, or how to bring back that awareness, okay, this is my thought that is causing this, this is my brain, this is separate, how to bring that awareness at that juncture.
Well, I think, that will only happen when you develop an insight into your own body, how it functions, how your mind functions, yoga, meditation, mindfulness, therapy, so that's the way it is.
Okay. So Thank you, Dr. Avinash, for really spending 1 hour in your tight schedule and giving us a lot of tips also, like how the software and the hardware and how to sleep early, and especially the insight that parents are from a different generation. They thought that homosexuality is a disorder, and all these lovely tips of hygiene. Can you please unmute that we could, he could give us 1 hour, which is so valuable. Can we unmute and give a round of applause? Thank you so much, Dr. Avinash, for enriching our life. And most importantly, being so easily accessible. You are such a busy doctor. It's the first seminar which you are doing, talking to people from Africa, but you are still giving your number and email ID. Thank you so much. And you have given me references also on WhatsApp. Thank you. You have a really big heart.
Thank you. Thank you. Yeah.
Thank you. Bye.
Bye.
Sir, come again.
Definitely.
Thank you. Thank you, Dr. Avinash. Okay, so now we are all together in this room, and it's been a week from last Sunday to this Sunday, people who are joined on Sunday. So open up, talk, share. And if you are in Bombay, please suggest places. We want to meet next Sunday for a movie, just to get out of our loneliness, to talk, So please